The Italian Deputy Health Minister Pierpaolo Sileri says that he believes Italy is currently experiencing the peak of the coronavirus outbreak. More than 10,000 people have died there, the highest death toll anywhere in the world. He told the BBC that the country might see a drop in the death rate in a week or 10 days' time. Mr. Sileri was speaking to the BBC's Andrew Marr.
I believe the lockdown starts to work. I mean, we started lockdown at the middle of March. I mean, we did start with the first lockdown between the 8th and the 9th of March. So obviously you need to wait at least 14, 17, 18 days after that to see the reduction of number of infected people. Over the last few days, we had an increase of infection. And this was due to the increase of the swab that have been performed. So we are searching more, and obviously we have more results of positive people, mainly with low and without symptoms.
Sorry, can I ask you to explain exactly what has changed, do you think?
Over the last 2-3 days, we start to do more swab, especially to trace and people.
You're testing more, basically.
We are testing more, exactly. And obviously, when you test more, you may find more positive people, and this will explain the increased number of positive that we found over the last 2 days. But I believe that we are living in the peak of this epidemic. I believe in 1 week time, 10 days maximum, we will see a significant drop of positive cases.
That's the Italian Health Minister Pierpaolo Sileri. And in fact, just as you were listening to him there, we've had some more official figures from Italy saying that the death toll from coronavirus has risen by 756. That's to 10,779. And we've also got the total number of confirmed coronavirus cases, so people testing positive for coronavirus in Italy, and that has risen to 97,689, and that's a rise from 92,472 on Saturday, so a rise of about 7,000 or so. Those are the latest official figures from Italy. Well, the number of coronavirus fatalities in Spain rose by 838 overnight, marking the country's highest daily rise in deaths. 6,500 people have now died from the virus in Spain, and there are just under 80,000 confirmed infections. It's one of Europe's hardest hit countries, but Spanish health officials say the virus there could be near its peak. Well, the journalist Graham Keeley has the latest developments from Madrid.
The government are going to approve these new restrictions. They will come into force from tomorrow. They will mean that essentially non-essential workers, these are, for instance, construction workers, postal workers, people working on production lines which don't relate to the epidemic, for instance, car workers, some opticians, and even people running shops that are not related to food, they will not be allowed to go to work for the next 2 weeks and will have to stay at home. The government is saying that they are cheered to some extent by the fact that the number of cases is beginning to level out. However, when you speak to doctors in hospitals, they say, well, that may be what the government is saying, but it seems that actually the problem is that not enough people are being tested because there's a shortage of testing kits. So the real picture may not be quite so optimistic.
And that's the journalist Graham Keeley, who was speaking to us a little earlier from Madrid. Now, Syria has confirmed its first death from coronavirus. The United Nations has said that all parties in the war-torn country must stop fighting to avoid further catastrophe, calling coronavirus a deadly threat. The World Health Organization says that Syria's health system has been acutely weakened by years of conflict in the country. The US President Donald Trump has backed away from imposing a quarantine on New York and 2 adjoining states, despite saying yesterday that he was considering the move. Instead, residents are being strongly advised against non-essential travel. Freya Cole has more.
New York City, home to more than 8.5 million people. now a dangerous hotspot for the spread of disease. There are more than 53,000 confirmed cases of the coronavirus in the city alone. Across the entire state, more than 700 people have died. President Trump told reporters he was considering a 2-week quarantine to stop the spread in New York and 2 other states. But just hours later, he backed away from the idea, saying on the recommendation of the White House Coronavirus Task Force and upon consultation with the governors of New York, New Jersey and Connecticut, I have asked the CDC to issue a strong travel advisory. Effective immediately, the Centers for Disease Control and Prevention urged residents in the 3 states to stop all non-essential domestic travel for 14 days. It says the advice does not apply to employees of critical infrastructure industries, including trucking, public health, financial services and food supply. The idea of an enforced quarantine had outraged some city leaders who feared it would paralyse the economy and cause mass confusion.
I didn't speak to him about any quarantine. I haven't had those conversations. I don't even know what that means.
The United States now has the highest number of cases in the world. Some medical workers say they no longer feel safe, pleading with residents to do the right thing and stay at home. Freya Cole, BBC News.
South Korea says it'll quarantine all new arrivals from overseas for a fortnight. Officials say that half of all new confirmed cases in recent days have been diagnosed in people who've come into the country. Our correspondent Laura Bicker was at Incheon Airport as the flight arrived from London.
This setup is all about protecting South Korea from a fresh outbreak of coronavirus.
Officials say that half of all new confirmed cases in recent days have been diagnosed in people who've come into the country.
All right, I think Purnima was not able to hear us. Let me go across to Rupashri. Rupashri, same question to you. How prepared is the state government? How many Indian citizens are likely to return to Delhi specifically from those evacuation flights? And how prepared is the state government when it comes to movement of migrants? All right, I think Purnima was not able to hear us. Let me go across to Rupashri.
Parikshit, regarding the return of the stranded Indians abroad who will land in the capital, Delhi government has issued a detailed protocol. In fact, it has also written to the central government, asking the central government to tell the Delhi government 24 hours in advance about the number of passengers landing at Delhi airport. Apart from that, 20 medical teams have been formed for screening, testing and quarantining people once they land in Delhi. And most likely these will be paid quarantine facilities, possibly hotels in and around the Delhi airport area itself. Apart from that, nodal officers have also been appointed for close coordination with the central government and also with all those passengers who are returning from abroad. As of now, there is no estimate on numbers, but as and when people start coming to Delhi, we will know in a few days from today. Now, about the return of migrants, now Delhi is a little different from the other states. In Delhi, large number of migrants have actually stayed in Delhi who also want to go back, but they are not inside shelter homes. So these are migrants who live in rented accommodation and most of whom say that if there is work available in Delhi, they would rather stay back here than travel back. But these are again the same very people who turn up in front of government schools for homes, for food. And remember, the Delhi government today is giving 10 lakh meals in the morning and in the night also to these people. So, but Delhi government now is not talking to all these people about their willingness to go back home. The government essentially is talking to the 10,000 to 11,000 people, migrants who are sheltered inside homes in Delhi, and has made a detailed list basing on their preference and choice. So they've been clearly asked whether they want to stay back in Delhi or would they rather prefer to go back to their homes. And then the Delhi government has made a list and been in touch with resident commissioners. And for the first time, after the coordination with the state governments, Madhya Pradesh has expressed a desire to take back its migrants. And the train from Delhi for Madhya Pradesh will be leaving later in the evening today, and about 1,000 to 1,200 people would be on that train. Most of them are absolutely destitute people, Parikshit. We have met some of them in the morning, and some of them did not even have a bag to carry any possessions, no money, no food, nothing at all. But they have been screened and they're not being charged any money for their return home.
Okay, thanks for joining us, Rupashri. Pallavi Ghosh also telling us about how many days it took for each country to reach the 50,000 mark when it came to coronavirus cases. Let's take a look.
How India compares to other countries as far as reaching the 50,000 mark. Now, we took 98 days to cross the 50,000 mark. How are we faring as far as other countries are concerned? Italy took 51 days. That means they reached it at a shorter time than us. So in 51 days, Italy reached. Spain took 56 days to cross the 50,000 mark. Germany took 61 days to cross the 50,000 mark. USA has taken 64 days, which is a little over 2 months actually. And India is at 98. UK took 67 days to cross the 50,000 mark. Russia took 82 days, so it's very close to what we are. And China took 89 days. In fact, that's where it all began from. Canada is almost very close to how many days India took. We've taken 98 and Canada has taken 95 days.
All right, let's go across to Purnima Murli. Purnima, tell us about the number of cases in Tamil Nadu, the rise that we've seen over the last 24 hours.
Well, 771 cases reported over the last 24 hours, 2 deaths recorded, and even the number of people getting discharged is only 30. Remember, over the last few days, a large number of cases are linked to Coimbatore market cluster, the wholesale market, where vendors had bought vegetables, fruits. They traveled to other districts, because of which many districts are also now seeing an increase in the number of cases. This is a challenge for the state government, which is why they said that asymptomatic patients will be under home quarantine, and only those who have symptoms will be treated in hospitals, because the number of cases, Parikshit, in the city and across districts has increased. In Chennai alone, more than 300 cases reported over the last 3 days, which is why only asymptomatic patients will be under home quarantine, and only those who have symptoms will be treated in hospitals. And now they are converting schools and colleges into isolation wards as well, considering that there is a number increase over the last 7 days. However, they are also prepared to welcome those who in fact will be coming back to Chennai in the coming days. The protocol is being followed. They are looking at quarantine centers near the airport, where they will place those who are coming from abroad to Chennai. They will be placed under quarantine as well. But for now, there is a challenge that the state government is facing in terms of containing the spread of virus.
Right. Thank you very much, Purnima, for joining us. Let me thank Rupashri Nanda as well. Let's get you another report from Uttar Pradesh now. Community kitchens in Noida have become the biggest source of help for migrants stranded due to the lockdown. Sagar Gupta with this report.
We are in a community kitchen in Noida, and you can see right behind me, many people have turned up to get just one packet of cooked meal. This just goes on to show that people do not have access to cooked food, and these are poor migrant laborers and poor people who live in jhuggies and slums in Gautam Budh Nagar, and they every day come to just get one packet of food meal. They carry their own packet, also the empty containers as well, to get the food for their family members also. You can see this gentleman, policeman in uniform, making sure that people maintain social distancing, because when food comes, people often forget to maintain social distancing. You can see circles being drawn on the road so that people should stand only under that circle, and this policeman is also making sure of the same. These are poor laborers who come every day. The biggest concern for the authorities here that people sometimes forget to maintain social distancing, and this is very important during the pandemic.
Hello everyone, good afternoon. You're watching CNN News 18. I'm Maria Shakil. India woke up to a very tragic news coming from Visakhapatnam. The death toll is rising. Over 200 people have been affected. The headlines we are tracking this hour. At least 9 people killed as gas leaks from a polymers factory trying to reopen post-lockdown in Visakhapatnam. Over 200 have been hospitalized. Prime Minister Modi chairs meeting with NDMA after speaking to Chief Minister Jagan Reddy. The first Air India flight from India to UAE to repatriate stranded Indians takes off from Kochi. One of India's biggest repatriation exercise ever begins tonight. Total COVID-19 cases in India crosses the 52,000 mark. More than 10,000 cases in Mumbai alone. And Prime Minister Modi salutes COVID warriors as he reminds the nation of Buddha's message on Vesak Day. Says India is using Buddha's inspiration to help the world amid the COVID-19 crisis. With cases in Maharashtra rising,
I'm going off to my first try today.
who has been regularly briefing the media
Thank you coming
every day at 4
live.
p.m. We have been seeing him. He is now headed
Thank
to
you,
Mumbai
bye, good night.
to take stock of the situation and to try and understand as to what really is going wrong. Let's not forget that as India hit for 52,000 mark today, 10,000 of these cases are coming from the financial capital of India, that is Mumbai. We'll try and connect to Sneha. Sneha is in fact joining us on the phone line. Sneha, give us the details.